Welcome to Abdominal Bandage Application presented by ShakyPaws.
Alright, welcome back to the bandaging series. So the next bandage that we're going to show you is an abdominal wrap. Some materials you're going to need is your cast padding, your Kling or your gauze, your bandage scissors, as well as your VetWrap. Now the purpose of the abdominal wrap is going to be either to cover a wound because of some reason or another, they got hit by a car or something, or a dehiscence. We need to put some sort of support bandage on there to keep all of the stuff on the inside before surgery happens. Now if we do have a dehiscence where we have organs or intestines or things hanging out, you do need to make sure you make this more of a wet to dry bandage. You're going to take sterile lap pads and soak them down with sterile saline and put it onto the abdomen, and that's going to be your primary contact layer, and then incorporate everything else that I show you. Another reason for the abdominal wrap is going to be for a hemoabdomen. So we've got something bleeding in here. We're going to try to apply pressure to prevent bleeding. So this is going to be a pressure bandage. And it's not going to be too bad. So if you have any wounds, cover up your wounds. If you have a dehiscence, go ahead and put your lap pads, sterile lap pads with NaCl, and then go around the patient. Now I know the chest wrap, to help keep that in place, we went ahead and made it like a little t-shirt. Well, we can't do that with the abdominal wrap. Any questions why we can't do that? And the problem with the abdominal wrap is if we're a boy, be conscientious of that. So we're a girl right now, though we don't have any problems. So you are going to go ahead and put your cast padding on. I'm putting a little extra layer here because maybe there's a wound that's draining a little bit, plus a hemoabdomen because we got hit by a car. So I'm adding some layers here. You don't add pressure with our cast padding. You're going to add pressure with your Kling. Now with the Kling, remember this is a pressure bandage, so with each pass you are going to go ahead and tighten up that bandage. If you have a large dog, don't be afraid of starting to crank that down. We are going to only leave this on for a maximum of 4 hours. So we do need to have that pressure. If the dog has been hit by a car, please be conscientious. They are going to be a little bit painful when you're doing this, and you may or may not be able to give them pain medication depending on their state. And then our VetWrap. With the VetWrap, remember this is a pressure bandage, you're going to be making it a little snug here. So you are going to make lines, not squares. Now I'm not going to be pulling this out to 100% tension. That's just a little too much, but 75 to 85%, yeah, that's probably what I'm going to be doing, because I don't want to strangulate everything, but I do need pressure. So hopefully you haven't incorporated the penis. And remember, this is a pressure wrap, so having wrinkles and creases is a big no-no for this. Yes, we're only keeping it on for 4 hours, but let's not cause any more complications. I did go ahead and overlap each bandage layer by at least 50%. And then you're going to look at the conformity of the patient. Now this patient is small, so it looks like I have incorporated the chest. Make sure you don't do that. If I was doing this on an actual patient, I'd probably only do about that wide because I don't want to squish the chest. Or if I have to incorporate the chest, as I'm doing it, I'm not going to add a lot of tension to the chest, just to the abdomen. Now look at the conformity of the patient. If we are a very deep chested dog, this bandage is going to slip all over the place. So your trusty Elastikon, don't be afraid of this. I'm going to go around the cranial and caudal aspect of the bandage. And if it's a big guy, I might do 2 or 3 laps just to make sure that my bandage is secure so it's not slipping all over the place. Especially if we've been hit by a car, we might be thrashing around a little bit. So I need to make sure that bandage is secure.
Thanks for watching this video, and for further information about ShakyPaws, check out the links below.